Good morning and welcome to the webinar. My name is Rob Billius and I'm the Business Development Manager at Cornerstone. Today I'm joined by our representatives from Medical Mutual for a review of fourth quarter 2024 updates. First, we have a little bit of housekeeping. If you have any questions throughout this presentation, please type them in the questions box and we'll address them towards the end of the call during the Q&A. On the screen is my information if you'd like to get in contact with me. Don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates. Contact your Cornerstone broker advisor if you are currently not subscribed. From downloadable social media images to customizable flyers, Cornerstone's Marketing Hub has what you need to start managing your marketing in-house. You can access the Marketing Hub through Cornerstone's Resource Center with your username and password. Contact Jess Larkin at the email at jesslarkin@crnstone.com with any questions, or you can reach out to me as well. If you didn't already know, all of Cornerstone's recorded webinars are available on the Resource Center under Webinar Series. This includes all webinars from each of the series, including the group corner. Feel free to contact me if you need help logging into the Resource Center. At this time, I'd like to pass it over to Sarah Jansen at Medical Mutual. Sarah?
Good morning, everybody. Thank you so much for allowing us to share your morning with you. We're going to be reviewing the small group updates as it pertains to the fourth quarter for 2023. On the call with me today, I have Dan Polk, who is our Vice President of the Small Group. Also, Lauren Schneider, who is our Superior Dental representative, and Madison Tilley, who will be covering the life and disability slides toward the end of the presentation. As Rob said, if you can hold your questions, that would be appreciated. Got a lot of slides to get through this morning, so why don't we just go ahead and get started. The topics we're going to be covering, MIWA, COSI BP, as well as the Alliance updates. Dan will cover the January 1, or I will cover the January 1 release timeline on the renewals, etc. HSA updates, NSA compliance, a couple of those legislations we can move through. There's an update on Balance Solutions. Dan will be covering the broker bonus broker conference as well. Your January survival kit, which kind of just is a last housekeeping topic, if you will, and then specialty product updates, Madison and Lauren cover those. Right now I'm going to kick it over to Dan Polk to take care of this slide.
Hey, good morning, everybody. Hopefully you can hear me all right. This is Dan Polk. I'm the Vice President of Small Employer Solutions here at Medical Mutual. And as Sarah said, thanks for taking the time this morning to go over some of this information. And, you know, here we go, right? It's fourth quarter. Rip the Band-Aid off. Let's just go. The first slide here we're going to go over, I think it's, I wouldn't say it's new news. Obviously, this is old news, but in the Cincinnati and Dayton area, with Humana pulling out of the commercial market, we are working on some strategies on that business. So, you know, work with your Cornerstone broker advisor. There are a couple of different ways that we could get some quotes out to you, you know, on the Humana business. So, you know, stay close with your Cornerstone broker advisor on that. But with that being said, go to the next one there, Sarah. Mm-hmm. And click the little button. You gonna play that?
Sorry, no, so sorry. One little button.
Move your arrow. There you go, that button right there. The arrow.
That's it?
There we go. Yeah, that's it. See, here we go. See, to us, small business doesn't mean, oh, introducing our new expanded Chamber Health Program partnership with the Cincinnati Regional Chamber of Commerce. And who's that handsome devil there? Yeah, we were. Okay, I decided not to be on camera because I didn't want anybody to see my face, but there you go. To us, small business doesn't mean small benefits. So you can move to the next slide. Obviously, with with Humana pulling out of the market, the Cincinnati Regional Chamber, as you all know, had their relationship and endorsed the Humana chamber plan. And with them pulling out of the market, we're excited to to develop our partnership with the Cincinnati Chamber. So we will now be the endorsed chamber, the endorsed carrier for the Chamber of Commerce for all lines of business up to 500 lives. We're very excited about it, right? Cincinnati is such a good area for us overall, and we're just excited to be more. You're going to see us more out in the market, and we're excited to be working with the Cincinnati Chamber. If you want to move to the next slide, because that being said, with the addition of the Cincinnati Chamber, Medical Mutual is now the endorsed carrier for all of the major metro chambers of commerce throughout the state, that being the Council of Smaller Enterprises in Cleveland, the Toledo Regional Chamber of Commerce, the Columbus Chamber of Commerce, and now, of course, with the Cincinnati Chamber. So, on top of that, one of the things we wanted to point out is, and you really weren't seeing this much in the Cincinnati market, and some of the other areas of the state, obviously our partners in Toledo as well, and in Columbus. Any group that would have to join any of those regional chambers, that being Columbus, Toledo, as you're aware, they had to join that regional chamber, but then also the groups would have to pay an affiliate fee on top of that in order to have access to the COSI BP MIWA. Starting January 1st, those affiliate fees are going to be eliminated to the groups. So the groups are not going to, the enrolling groups are not going to have to be paying that additional affiliate fee, which I believe was $3 per contract per month. Those affiliate fees are actually going to be absorbed and handled by the regional chambers. So, I think that's a very positive, that's a positive step towards, because again, that's an additional expense that the groups would have to pay joining the Chamber of Commerce and having that affiliate fee on top of it. So there will be no more affiliate fees that will be paid by the groups that enroll in our affiliate chamber. So we're excited about that. Move on to the next one, Sarah. Oh, now we're handing it back over to Sarah for some of the other updates for one that we're looking at as well.
Thank you very much. That little slideshow was in there.
Isn't it? See, there you go. Huh?
There you go. We're fancy. Okay, so as far as some of the updates that we'll be covering, we're going to start with the Medical Mutual Wellness Program that becomes effective January 1st of 2024. Basically, this is a program that will be offered to the employer groups. It's an opt-in program, if you will. And what it does is it kind of gives a wellness platform to add it a little more enhanced in the sense that it does include employer reporting for the employee engagement in the program. There are points to be earned for online health assessments. To complete that through My Health Plan, which is the member portal. The health screening is 1 point, your flu shot is 1 point, and then preventive care services are 1 point. Again, this is an opt-in and it is $1.65 per employee per month. The pricing will be in the starting new business 1/1 of 2024 proposals, as well as the renewals 1/1 of 2024 for groups to employers to engage in that program. The actual incentives and rewards that the employer does give the employees for the engagement is purely his or her discretion. Could be a day off, could be a gift card, something along that source, but again, that is the discretion of the employer. Hey, why is this not forwarding? This is not forwarding. Jess?
The slide isn't moving.
Nope.
Maybe try going to exiting out of full screen and then going back to full screen. Maybe that might work.
Are
you able to just hit the escape button and let it go out?
Yeah. It's
Your
not.
computer might be frozen then. Are you able to send the presentation to Dan and then I can have him share a screen, or Madison?
Yes,
Absolutely.
that's fine. I have it here if you want, so you could just share it over to me.
Okay.
It's
Oh, it
moving,
was working there.
it's moving now. It's moving.
Now you're
Okay,
going.
there we
Yeah.
Oh,
go.
golly. Okay.
They're like, no, we don't want Polk dealing with this. God knows. Forget it.
Sorry about
All right,
that,
there you
folks.
go.
We were frozen. Okay, the other wellness program that we are introducing or have introduced with a 5/1 effective date is our pet wellness. It is through WAGMO. It is not a cost that's passed on to the employer, so it is free. Again, it became effective 5/1 of 2023, and basically it's a reimbursement program per contract. So everyone that is enrolled in the medical plan is able to, per contract, not family member, go into My Health Plan and register a dog or cat, and then be able to get reimbursement for wellness, such as up to $350 of annual benefit reimbursement, one per year for a routine exam, $100 for vaccinations per year, $100 routine blood work, one per year, and then up to $50 for a fecal test, one per year. Again, this is a reimbursement. It is not a claim, if you will. There is no network associated with it. It's just a registration process, and it's up to $350 per year for one pet per contract, a cozy contract.
Sarah, can I jump in too, just real quick, just to save any confusion on this? As Sarah had mentioned, this was effective 5/1 this past year. So what that means is it's a year-long program. So it was effective for groups with renewals from 5/1/23 on, right? So as this is all in the COSI benefit plan as well, not in the grandmother, grandfather block or balance solutions. It's all COSI benefit plan. So it's for new business going forward from 5/1/23 and for renewals going on for 5/1/23. And again, no additional cost. It's just a value added to those groups that are enrolled with the COSI benefit plan. So I just wanted to make sure that was reiterated, because sometimes there's some confusion on the timing of that. Sorry,
Yep.
didn't mean to jump in.
Very good, thanks. As long as this these slides work, I'm good. Okay, the Takeda update and reminder. Just wanted to remind everyone that we do have another MEWA with the Greater Cleveland Auto Dealer Association. And it is a restricted MEWA in the sense that it is for motor dealer SIC codes only. It is available from any size group down to one. And it is, an association. There is a fee that is due for a yearly fee if you wanted to access the health plan. If any of those motor dealers want to join, it's $450 annually. There isn't a universal or an annual renewal date of May 1st. It's not a rolling renewal date like COSI MEWA. It is May 1st. So for more information about this, please reach out to your Cornerstone broker advisor. They can work with sales in order to get you a quote for that. And again, it is restricted. So it has to be a motor dealer SIC code that qualifies for this particular MEWA. The benefits, the standard plans will be available for market size for 1 to 99. If there's a 100+ group, they start with the standard benefits and they can make some moderations from there. Dental and vision only groups are not permitted with a few exceptions, but at any rate, depending on the size of the group, but it has to be medical as well. Included in the medical coverage is the nurse line, telemedicine, chronic condition management program, and the MedMutual Basics Wellness are included as well. The COBRA option, or the COBRA service, basic administration service, is also available, but that's through WageWorks. Takeda will handle that with those Takeda groups. The RX plans include your National Preferred Plus formulary, the Walgreens Advantage Network. The following programs are also included for the RX benefit plan. It has generic incentive and mandatory mail order, prior authorization, step therapy, quantity limits, specialty solutions, and Save on SP are also included. With regards to the 5/1 anniversary date, if your groups with 51 plus, underwriting can offer up an extended contract up to 16 months. If it is a 1 to 50 group, it would have to be a short contract, and then on May 1 they would receive a renewal going forward for May 1, just to kind of sync them up to the May 1 anniversary date. The alliances that we're working with throughout the state of Ohio, with your larger groups, your 51 plus groups, or if you're a part of these chambers, groups are eligible for a 1.4 premium tax savings. Those chambers are the Greater Cleveland Partnership, COSI, Greater Akron Chamber, the new Cincinnati Chamber, Richland Area Chamber, and then Alliance of Ohio Chambers. You would work with your Cornerstone broker or your medical mutual sales representative in order to learn more about that 1.4 tax savings. The Greater Akron Chamber has struck a deal with the Employers Association, which is our wellness platform that we partner with for the 51 plus market space. And that's working very well. I don't know if any of you are familiar with that, but it is a wellness platform that for a extremely inexpensive annual fee of $75 provides wellness coaching, also provides employer and employee rewards based on employee engagement, and also group utilization in terms of their claims are concerned. So it's been very popular for Medical Mutual, and it is, as I said before, only available for the 51 to 99 market space with 40 enrolled, down to a minimum of 40 enrolled. Coming soon, that partnership will also be extended to the Cincinnati Chamber. So more information will be, forthcoming on that. We will certainly let you know when that is available for your prospects. These are the January relief schedules that as far as our renewals are concerned, your grandmothered and your COSI BP have already been released. Your small group ACA will be coming out October 16th. Balanced Solutions, which is our level funded program, will be coming out in November. And then your 51 to 99 renewals will be released October 16th. It's important to note that, again, these are all target dates, so we'll try to keep on target with that. But keep in mind that the renewals are released in batches, so you may not receive, depending on the platform that you're getting, all of them in one single day because they are batched. For Balanced Solutions, the new business rates will not be available until October 1st. And also, as a reminder, standardly, Medical Mutual will accept medical health questionnaires up to 120 days from the effective date. That applies to your 1 to 50 market as well as your 51 to 99 market. So this is some good news, we think. We have, over the past years, or maybe even prior to that, had just some concerns about our rating methodology in terms of, for COSI MIWA, groups of 1 to 9 were age banded, groups from 10 to 50 were composite. Where the challenge occurred is if for new business, a group came in and they were, let's say 12 on the plan, and you were composite rated at new business. And then at the first renewal, the second renewal, or whatever, they dipped down under 10 and were given an age banding. And then also the reverse of that, right? So that presented a challenge to the employer in terms of employee contributions and how are we going to structure that going forward. Because that was such a challenge, we will, beginning January 1st of 2024, be composite rating down to 2 to 50 on our COSI BP. Your single groups or your single one life groups, would get an age banded rate, but your 2 to 50 would get a composite rated renewal as well as your new business proposal. The other renewal updates to cover is the grandmothered and grandfather blocks. Pool continues to perform well, so that's wonderful. In our renewals, we continue to minimize rating actions, so that hums along very nicely.
If I could jump in too, just real quick on the composite.
Sure.
Yeah, sorry, I'm like the peanut gallery back here, but
No, you're good.
on the composite piece, just keep in mind, we're very excited about this. We listen, right? We've been hearing this feedback for quite a while on the age banded for the under 10. But this is, again, that affects the COSI benefit plan only. Your grandmother, grandfathered that have the age banded for under 10 still will continue to be age banded. So bear that in mind. And also, it also affects on the renewals, right? Starting January 24. So, and the renewals are out already. So with your groups that have under 10 enrolled, they have gone from a age band to a composite rate. So just keep in mind, I mean, there's, I always say, be careful what you wish for, because sometimes when you combine everything like that, there might be some outliers where some groups might be getting a little bit higher increase just because of the makeup of the group. We've done what we can to minimize those outliers. But there could be some groups that are getting maybe a higher adjustment as a result of going from the age band to the composite. And again, work with your Cornerstone rep to maybe alleviate any of those big swings in the renewals, and we'll do what we can to accommodate. So just wanted to mention that. Sorry, go ahead, Sarah.
No, you're good. Okay, so this is just a slide on the HSA, the limits, the 2024 HSA limits determined by IRS, and it just will kind of give you the overall on the block in green, coded in green, 2 to 50, talks about the product, grandfather, grandmother, or the MIWA, and then it details the plan that is impacted by that. Moving to, and basically it's what it's done is bumped up the deductible limits on that. The mid-market, which is the 51 to 99, highlighted in purple down below, talks about all renewals and new business. Also names the plans that are impacted by that. This was kind of blasted in a broker update, probably on back in, I think, September or early September. So it was in the broker update. If you wanted to go into my broker link and pull that under news reference, or also, talk to your broker advisor about that. But this is what the impact would be on those named plans at renewal for both market spaces. The legislation, the next two slides talks about some legislation updates. The first of which is Section 204 for the Consolidated Appropriations Act. And basically it refers to the RxDC reporting that is due in June annually. And what is required from health insurers in order to, on certain data related to the prescription drug benefit portion. First of all, what is needed within these surveys is for the plan 5500 number. That would apply to large group only, large group meaning 100 plus. It does not apply to the small group market space. The premium split information, how that is communicated or how that is collected for your small group 1 to 50. New business is collected via the group application at new business. Renewing business will collect survey information via a QR code as well as a link that is contained in the actual renewal. For your large group 51 to 99, that is also new business collected on the group application. And then the renewing business going forward, we will need to answer the CAA information in the renewal. That's very important to return that to the account executive, that is the medical mutual account executive that is handling the actual 51 to 99 renewal. That information has to be reported, and in order to successfully renew the group, we will have to have that signed renewal back to the account executive. The other legislative update impacting the renewals is the gag clause attestation, section 201. Medical Mutual will submit an attestation to the government annually by December 31st each year on behalf of the group. That would apply to both ERISA and non-ERISA groups. The group type question will be added to the applications as required. Important to note that, we've had some questions on this, and there was a announcement that was released stating that Medical Mutual will submit the attestation to the government on behalf of small groups that had medical mutual coverage in 2021, 22, and 23, and are still active. Groups that were active in 21, 22, and 23, but are not currently active, are responsible for providing their own attestation to the government. I can't say that word. Going forward, Medical Mutual will report this information annually for our small groups. And this is yours, Dan.
Oh, I get the fun stuff. Okay.
You get the fun stuff.
Yeah, this is hot off the presses. You'll be seeing more of this probably in a broker update. And again, check with your Cornerstone rep on this as well. But we are introducing a new business bonus specifically for the COSI benefit plan, and it will also be available for the GCADA MIWA that Sarah talked about previously. But so this is for groups with 5 or more enrolling, 5 contracts or more enrolling in the 2 to 50 segment. Start with January 1st effective dates. It's a statewide program. The gatekeeper is 50 contracts. So once we get 50 contracts from the agency, from your agency or from independent agent, 50 to 74 contracts will pay an additional $50 bonus, one-time bonus. 75 to 99 will pay an additional $75 per contract. And we get 100 or more contracts, we'll be paying $100 per contract. And that includes, all business, including any of that Humana business that is not renewing for January 1st with Humana. We'd like to have those opportunities and, see if you could earn a little bit extra cash. Again, keep your eye out on our for a broker update with some additional information. We'll have the usual additional terms. It's got to be new business and that type of thing. But we're excited to be offering that. Actually, this is just hot off the presses, so we got approval on this yesterday. So you're the first to hear it. So there you go. Next slide. Balance Solutions. I think most of you are familiar with our level funded program, the Balance Solutions program. And if you're not, you can talk to Sarah about it, talk to your Cornerstone representative. But we do have a bonus in place that will be, it's been in place for the better part of 2023, but we have extended that for January 1st, 2024 effective dates. For our level funded program, Balance Solutions, we will pay $105 per certificate holder with 4 groups set with an effective date of January 1st, 2024. Well, actually through the 4th quarter and including January 1st, 2024. We also offer an implementation credit for new sales of $150 per member. That's a one-time credit for groups that are enrolled in Balance Solutions. And as far as the Balance Solutions program goes, you have to again work with your Cornerstone rep and with Sarah on these. We will issue the rate where we feel it's going to be most competitive, whether it be Balance Solutions or the COSI benefit plan. It just depends on the makeup of the group. Generally, COSI benefit plan is going to be more competitive for those groups that are under 20. 20 plus is where you start seeing it tipping a little bit more towards Balance Solutions. So we do not like running both of them simultaneously. So you'll be talking to Sarah and your Cornerstone rep as to which route you should go, where it has the best opportunity to sell with the Balance Solutions or COSI benefit plan. And that, again, Balance Solutions is available for groups in the 10 to 50 market segment. You'll start seeing it more competitive in the 20 plus. Then on top of the new business side for renewals for Balance Solutions, this has been going on for the course of the year as well. At the group's first renewal, and that includes their first renewal, which would be January 1st, 2025, for groups that are effective January 1st, 2024, we will pay an additional $105 per for contract holder after the group renews for Balance Solutions. So again, that's a one-time bonus. So altogether, for the first 2 years, you can earn $210 per contract for Balance Solutions quotes. That's with effective dates up to January 1st, 2024. Next one. Just a little reminder too, you've seen some information on this in our broker updates, and I'm sure you've also heard from Sarah as well, is that we do have a broker conference that that you are eligible for qualifying for. And it will be held in May, well, you see the dates right there, May 19th through 23rd of 2024. And you could qualify for the broker conference. It is a meeting. It's a good opportunity to meet with some medical mutual executives, spend some time with some med mutual executives. We do have a couple meetings set up, but we do manage to have a pretty good time as well. And as you can tell, as you can see, it'll be held at the Hotel del Coronado in San Diego in May. There's a number of different ways that you could qualify for this broker conference, primarily with our, with the people we have out there today. We're looking a little bit more in the smaller group segment. So 150 new medical contracts in the 2 to 99 market segments, as in 1 to 50, well, 1 to 50, so that includes sole proprietors in the COSI-MIWA, and 51 to 99 market segments, 150 new medical contracts during the course of the year in 23, including 1/1/24 effective dates, will earn a trip for 2 to the broker conference. So it's pretty manageable and it's pretty reachable, especially with all the activity we have coming in for January. So keep that in mind as well. We'd love to see you out there. Because again, it's a good opportunity to meet with a lot of other executives and maybe spend some time with some other medical mutual employees, the sales staff. And like I said, we manage to have a good time. There are other ways that you can make the program as well in the large group segment, as well as specialty being dental and life as well, depending on the premium sold. So any questions on that, you could, again, talk to your Cornerstone rep, talk to Sarah, reach out to me. We'd like to see you out there. So next.
Yep. Yeah, I just want to add that there was a broker update released in May of this year. So that's available on my broker link, or you can reach out to your broker advisor for this, just get a copy of that highlights those details.
That's good. Oh, and in the end, this is our ongoing bonus that we have, our volume bonus. Depending on your small group book of business, we start paying a bonus. Now, when you see this bonus amount there and you see the asterisks there, keep in mind that $50 to $149 to $4 is paid on up. That's primarily going to be paid on your grandfather block. For the COSI benefit plan, that amount is actually $2 less. So 50 to 149 for a COSI benefit plan, it's $2 all the way up to $11.50, depending on your small group block of business. And that's an ongoing thing. We'll have an update. Right now, it's just that we have to go through the approval process every year, but we'll have an update with the updated January 2024 as well. So that'll be ongoing. Back over to you, Sarah.
Yep, back to me. This is the just the survival kit, if you will, the housekeeping, just to remind everybody about where information is housed. First of all, the COSIbenefitplan.com. This is COSI's website. All the marketing material, your forms, the benefit highlight sheets, the SBCs, additional information on the plans, all are housed there. They just redid this website last year. I think it's very intuitive. It's very easy to navigate through. So certainly feel free to visit that site if you have questions or if you just want to peruse around. My broker link is important for our broker partners, and it does provide for our brokers a lot of different functionalities. You can certainly look at your book of business, their group details, talk about, looks at the invoices. You can pull your certs from there. You can order ID cards. And then also there's the compensation tab, which will house the Schedule A that just breaks out the compensation that is paid for various lines of business, as well as the group sizes. There's also a Knowledge Center news, and that's what I was referring to earlier. That's where your broker updates are housed. So again, a lot of different options and functionalities on that particular website. Employerlink.com is the employer site that requires registration. The employers can manage their enrollment through that website. There's also employee information that is accessible. They can pay monthly bills, go paperless, and avoid the $25 monthly admin fee. View, download past billings, order ID cards again. The certs are there as well as also the benefits are housed there. And then, you know, other forms and documents that are important to be able to access quickly. So do know that when a employer enrolls an employee through that website, it's not instantaneous. So just be aware that it does maybe take a day or two for it to feed over to the actual to membership and to be posted on my broker link. My health plan is, of course, the member portal, and that is where everything is housed for claims and you know, your dependents that you cover, registration for some programs, namely WEGMA, we talked about earlier, which is the pet wellness. So my health plan is for each member that is enrolled in the medical plan as well. These are all available 24 hours a day, 7 days a week, 365 days a year. So it's all right there if you are working off hours, which many of us will be going forward. Next is specialty updates, and I think that is Madison Tilley. Madison, are you on the line?
Yes, hi everybody. Thank you, Sarah. My name is Madison Tilley. I am a specialty products representative dedicated to the small group market segment, so 1 to 50 lives. And I just want to go over a quick, brief overview of specialty products. I always like to start with this slide just to go over for Medical Mutual what a specialty product is to us. I think, you know, different carriers have different ideas of what a specialty product is. So as you can see, we have life insurance, disability, dental, vision, and indemnity products. Next slide, thank you. MedMutual Life is just a branch off of the family tree of companies that we have here at Medical Mutual. We are a local Ohio-based company. That's something I really like to hone in on. Other carriers may have branches in other states or even other countries. We like to focus as well on a boutique approach. You have direct access to a dedicated claims analyst. There's no 1-800 number or automated system or IVR or anything like that. And that's something that I really like to talk about. We take pride in that. And we have a quick claims turnaround time, 3-day average for clean claim. And lastly, we have flexible and creative focus groups on life and disability solutions to meet the unique needs of our customers. And at the bottom, that's just a photo of some of our clients. I think that that's a pretty cool, you know, the Cleveland Browns, things like that, Cincinnati Bengals. All right, next slide, thank you. All righty, moving on to our product suite for 50 lives and under. Life insurance, flexible plan designs, again, claims turnaround time of 3 days. Something that I think is interesting, we offer living benefits on our basic life insurance. All cozy life quotes include a telephonic EIP service and 10-99 in-force savings strategy. This is available for new or current clients. If you move your life benefits with MedMutual Life, you can save 10% on your premium. Disability, again, flexible plan designs, a quick claims turnaround time, and a dedicated claims analyst. And for our indemnity products, we offer accident, critical illness, and hospital indemnity for 1 to 50 lives. We have 6 standard shelf-rated plans. And if you have 2 or more eligible employees, you have the ability to offer multiple plans, being 1 plan or all 6 plans. These are sold individually, or we have combo plans that include all 3 accident, critical illness, and hospital indemnity. And I always like to include this slide pretty much just as a reminder. This is all the information that we need to quote life and disability. So obviously group name, group address, SIC code, current policy or certs, effective date, broker or agency of record, commission level requested, and of course a census. And lastly, I just want to go over really quickly our vision providers. For vision coverage, we work with 2 of the largest carriers, IMED and VSP. If you look at the statistics I included, it looks like VSP might be a little smaller than IMED, but I just like to state that that is based off of an independent provider, whereas the IMED number, it's based off of independent and, you know, retail providers, like LensCrafters and stuff like that. When it comes down to choosing whether you want IMED or VSP, obviously it depends on channel, as you can see at the bottom, or it comes down to, do you prefer Costco and Walmart or Sam's and Target? Both IMED and VSP include SVS Vision, LensCrafters, and Pearl Vision. So it really comes down to those other providers as a preference, I guess. That's all I have. So now I want to pass it off to Lauren. She's going to go over Superior Dental Care.
Thank you. So I know we have a hard stop at 10:45, so I will talk fast, which is usually my normal as how I talk. So if you do have any questions after the call, as I briefly go over some of the dental information, I just wanted to put my contact information up here and a quick reminder of our teams. Even though we are part of the Medical Mutual family, we still have our account services team, which, as you can see, I listed all of our members there. And this really is the biggest the team has ever been, really in the past 5 years. So you do have the access to the account services team. As you know, for any current clients, that is the best way and fastest way you will get a response. I am your sales consultant. Again, my name is Lauren. We have the manager of account services is Melissa Smith. And then I'm sure all of you are familiar with Shannon Ford. She is our director of specialty products. So for the next slide, I just wanted to go ahead and announce we have not made any changes to the rates for January of 2024 for our small group shelf rated plans. Those are still the same. I know it has been in discussion that looking at February 1st effective dates, we are looking at adding something more additional as far as the out of network with the UCR. I'll go ahead and dive into that a little bit more. But as of now, and for any of your January 1 small group shelf rated plans, those are out there and there are no changes to that. So we do have the 4 that are still offered. Quick reminder, those are for 2 to 50 that are enrolled, not eligible. If there is anybody over 50 enrolled, 51 plus, we will go ahead and underwrite them. We just ask you give our underwriting team anywhere from about 3 to 5 business days to turn that around. For our small group, just a quick reminder, implants are covered under the major category. And then one thing, I'm not going to go over all these individual services, but as a reminder, I know it's kind of cut off on this slide. Any ortho plan that is chosen on our small group, it is automatically included that adult ortho is included. We just have to have 10 enrolled at all times. So that is not an additional charge to have adult ortho added. So please keep that in mind. That's definitely a rich benefit for our small group platform. And then as you go through our rate sheet, oh, no, back one more, I'm sorry, not there yet, real quick. On our rate sheet, we do have it sectioned off if the contribution for your groups are employer paid, voluntary, or open participation. As you can see, there's a chart in the middle with quite a bit of numbers, math that comes into it, which I like to then dive into our rate calculator, which is on our next slide. To avoid any confusion, I really like to use this rate calculator, and really what it is you go out on our website, just superiordental.com, and you really can just pick and choose what plan you want for your group off of our shelf rated plans. So if it is that open participation and you do have to, or I'm sorry, if it is the voluntary and you have to add the 10%, 10% is pretty easy to add for our math, but you can go out to our rate calculator and it creates a nice rate sheet for you where you can specify it to the group, their effective date, their specific plan design. If you do want UCR added, we do offer 80th for our small group plans. And it is actually being in discussion for those February new plans that we are potentially rolling out to add it to 90%, just to kind of match the market that's out there to match the other dental plans and the other dental carriers. So this rate calculator, if you do have a second and you really just want to get a quick quote from us and you don't want to have to do the math, it is a nice clean sheet that you can just download a PDF and email it to yourself. You can download it and then send it right to your client, and it is specific to them. So keep that in mind. And then next, as just a friendly reminder, if your medical mutual plans are enrolled with Superior Dental as well, and they have the same effective date, they will receive a combo ID card. So I just wanted to give a screenshot of what that looks like. Their dental is on the back of the ID card if it is a combo case. Anybody Any dependent over the age of 18 will get their own ID card, and we no longer list dependents on our ID cards. That is something different that SDC used to do. So if you get that question, come any of your new groups, our dependents are not listed. And then our member services team and plan number is on the back of that ID card. So since we are enrolled in one system, if they do get a hold of Medical Mutual and they need a dental question, they will get sent over to the right person to answer any dental questions about SDC. I know I hit my time. So my last slide is really just my value-added benefits. Oh, did you duplicate that slide?
I don't know.
You did. It's okay. It was just briefly on our, yeah, it was our value-added benefits. It's okay. Really, I just wanted to add a quick reminder, we do not have any waiting periods and we do not have any missing tooth clauses as well. So keep that in mind for any new groups or any new prospects for yourselves. And that's all I had. I did have a value adds. I just wanted to bring up our free second opinions. Those are all out on our website. Should you have any members that need to get a second opinion, it is free to everybody enrolled. And that was all I had for today. So again, if you have any questions about the dental this year on the small group, please reach out to me or account services, and we'd be happy to answer any questions you have.
Thank you, Lauren.
Thank you.
That concludes the slide. Do you want to open it up to any questions, Rob?
Yep. Currently, I don't see any questions here. Give it a 30 seconds, a minute or so, see if anything pops up. If not, can reach out to any of your contacts at Cornerstone, and we're happy to answer any questions you may have.
Very good. Thanks, everyone. We're going to hang out for a little bit, but we do appreciate your time this morning. And we certainly value your business.
I'm really not seeing anything pop in, Sarah, so if I get anything, we will reach out.
Okay.
Sounds good.
Have a great day, everyone.
Thank you, everyone.
Thanks all.
Thank you.
Thanks,
Bye-bye.
everyone.